Ladies and gentlemen, welcome to this edition of Health Talks with Bibi. The month of October saw the increase in campaigns against breast cancer. The World Health Organization reports that 1 in 12 women suffer from this disease, while 1 in 72 women die from it, making breast cancer the most common amongst adults. It is reported that in 2022, global mortality stood at 800,000. Here at our studio today, we have 2 guests. We have Aisha Ndi. Aisha Ndi is a state-registered nurse with over a decade years of experience. She currently works as a nursing supervisor here in Doha. She will be talking to us and answering a few questions related to breast cancer. Our second guest is Margaret. Margaret is a survivor. She also will be sharing her experience with us here at the studio. Don't go away. See you shortly. Aisha, welcome to the program today.
Thank you so very much.
The month of October saw an increase in health talks and campaigns against breast cancer. We want to find out from you, what is cancer, or better still, what's breast cancer?
To start with, cancer is the multiplication of cells, a rapid multiplication of cells, and breast cancer is the multiplication of cells of the breast. So now this is specific, like in giving the location, because when we talk about cancer, there are so many different types of cancer. So it is okay to say that it's a group of disease conditions that results as a rapid multiplication of the human cell.
So if we say there is breast cancer, are there any other cancers?
Yes, there are.
Okay. Now, is cancer generational? Can it pass on from one generation to the other?
Well, unlike probably we'll be talking about other disease condition where we can say passed on in the sense which you mean, like in some kind of cultural handing over. No, not like that. According to WHO, I think only 5 to 10% of cancer is actually hereditary, and this is as a result when you start having a frequency of a particular cancer in a family. So if my grandmother died of say lung cancer, and then my mother died of lung cancer, I think I should be preparing myself or tilting my attention to looking something is wrong. So it is only if it is a pattern of a family. If not, at a greater extent, it can be hereditary. You can take, because it's as a result of the mutation of a particular gene that when passed to the next generation, the individual is probably going to have that particular cancer.
If say a mother dies of breast or lung cancer, the child dies of lung cancer. If a member of that family dies of, is it possible for a member of that family to die of breast cancer, not lung cancer?
Yes.
In that case, should we say it's hereditary?
Well, they have a trait. They have a trait because there is already a history of cancer in the family. So the possibility of having now another type of cancer is not completely rare. There is a possibility. Yes.
Okay. Is cancer preventable?
Yes. We definitely can prevent cancer. It is preventable, though not 100% preventable. And if you already realize that you have some kind of exposure to cancer, it is best to prevent risk factors. And when we talk about risk factor, everyone should be on the lookout. We're talking about aging, which is a risk factor. We're talking about lifestyle. We're talking about just being female is already a primary cause of a risk factor for having a breast cancer. So there's a whole lot to put together in order to avoid those risk factors. And when it comes now to direct prevention, we'll be talking about no smoking, which is a very high rate as such. We'll be talking about limitation of alcohol or no alcohol at all. We'll be talking about living a healthy lifestyle. We'll be talking about checking your weight and making sure that you are within your index. We'll be talking about a lot of things, food, nutrition, and all that. Yes. Okay. There is ways in which we can do to prevent
this
cancer.
Breast cancer, does it affect men or is just specifically for women?
Most people that suffer from breast cancer or that are diagnosed from breast cancer are women, and these women probably of the age of 50, 45, 50. Not that it does not affect other classes of ages of people. No, it affects all ages, but most people diagnosed with breast cancer from 45, 50 and onward. And yes, in WHO has it that 1% out of 100 diagnosed cases is a man.
Men.
Yeah.
On their breasts.
Yeah. You know, you might, they say the origination of the cancer cells of the breast start from the breast lump or the milk duct, which that is a reason for which women are more prone to it. Breast, even though you might not have the breast duct as other, you still have a little bit of breast cells, fatty tissue under your nipple. And that small piece can make a difference for your life if you are unfortunate to be diagnosed as a man.
Okay. Now, what are some of the signs and symptoms that if someone notices, they can begin to suspect that they have cancer?
They have cancer. We can talk about swellings. Now,
swellings on the breast?
On the breast,
okay.
Yes. Especially the nipple or areas around the nipple. We're talking about swellings, we're talking about dimpings. You just get up and then it feels like one part of your nipple has fallen inside. It's dimpled. There's something wrong. It's not normal. We talk about discharges that are not breast milk. Other discharges might be prevalent, it might be not. We could talk about that is inclusive with blood fluids. If you just get up and your breast is bleeding, then something is going on. We're talking about pain. If you have unusual pain, we're talking
on the breast, on the breast area.
Yes, we're talking about lumps. If you get up and you feel a thickened lump that is movable or not movable, there is a call for concern. So yes, you need to start checking.
Okay. So in your years of being a nurse, I understand it's close to a decade now.
Yes.
Have you had cases of cancer patients?
Yes, I have had a good number of cancer patients.
And out of this number, approximately how many percent survived? Did they happen to die?
Well, there's a lot that comes with cancer. And first off, it's like when diagnosed of cancer, the first challenge is that we need to keep the minds of these patients active, because they start dying from their head before actually being killed by the cancer. And again, most cases are diagnosed late. So when the case is diagnosed, when there's already metastasis, the disease has spread to other parts and organs of the body, sometimes there is really nothing the health team can do to assist. We can only give you palliative care and all that. But withoutstanding, a good number
palliative care means?
Care for the dying.
Care for the dying. So you usher them to their grave?
We don't usher them to their grave. We make sure that their last days on earth is beautiful.
So in effect, you're saying that there were cases of fatality?
Yes, a lot of them. Especially most of my time in the nursing field, I did that in Africa, in Cameroon. And you know, money is really a big part. So even if a woman discovered there's something wrong, she might not necessarily go to the hospital immediately, because now we are talking about finances. There will be screening, there will be all this, which is an important aspect of the procedures that needs to be followed up when you come with a complaint of breast lump or pain, nipple pain, without any necessary cause of injury or trauma. And because of this, many women go to the hospital when it's already pretty late. That is after discovering that they are not just having pain now on their breast, maybe the other breast is not affected, they have pain under the armpit, lymph nodes are swollen. Okay, now they go to the hospital because it's already very late. And when they get there, the spreading is on a very extensive rate. Even if we have surgery and the breast is removed, they're spreading. And when we notice that, we start counseling the patient in preparation of all the other things that can set in. Yes. And there is screening that can be done, there's chemotherapy that can be done. But no one can actually say for sure that
they will survive.
Will survive, yes. So if it is so late, we have to make sure that we are nice enough to walk you through so that you get in peace with yourself and the people around you and those that you love, and then you live your last days being happy.
That's quite scary.
It's scary, yes, but when you get there, you take it step by step.
Now, I have seen lots of medical personnel talking about, advising women to allow their breasts to their men to have a good part of it. I want to find out from you, what's the relationship between having men suck the breasts of women, and is it some kind of cure, prevention? What's the relationship? Is that some kind of chemical I don't understand. Can you explain?
Yes. Okay. I'm sorry. Now, this misconception has been around for the longest period ever. But the truth is, there is no kind of cure or there is no kind of prevention sucking of breast brings to a woman as long breast cancer is concerned. Now, this is where it comes from. When they ask the women to at least breastfeed the baby for 6 months to 1 year, this is because there are certain hormones that are produced when a child is breastfeeding. And these hormones can go a long way to prevent this woman from actually having breast cancer. So a later agent, it is a preventive method, okay? But
so let me come in again. When women breastfeed children for long, is that a way of preventing cancer?
Yes, it's a nice way of preventing cancer, a nice way of doing many nice things too.
Okay.
All right? It's equally a natural birth contraceptive.
But we are talking here about adults, and during which time I think the mother should not be
breastfeeding.
Yeah.
That is why I'm telling you, breastfeeding is part of it.
That's
because
correct.
These hormones are produced beforehand, and these hormones helped in making sure that all her system and every other every other hormones that is produced helps. Some of those hormones helps to prevent the abnormal multiplication of cells. However, when we are not talking about men sucking their wives' breasts, it does not come with any hormonal secretion. It does not come with any benefit, except for the fact that it's going to arouse the woman and the man. But there's a good part to it. There's no story that just comes.
What is that good part?
The good part is that when we talk about breast cancer, the first thing is early screening, early diagnosis, all right? Early detection. And when we talk about early detection, it is easier for the man that fits on that breast to be able to identify that something is wrong, something is different. And because he is the one that has been visiting this breast often every day, he is going to realize that there's a change in size. He's going to realize that there's a lump somewhere. He's going to realize that what he sucked before, there was no milk, nothing coming out, but now I feel like something is coming out, okay?
Right.
This is going to call for concern. And he is going to ask, are you pregnant? Is there something different? If there's no pregnancy, then something is wrong. So what is wrong? So the man is going to help in early detection of abnormalities that comes with breast cancer. Hence, this woman is going to go to the hospital at the right time and get diagnosed at the right time. And this is going to permit the healthcare personnel to intervene when it is too right. So that is the part to play.
Is cancer treatable?
Yes and no. Yes, for the fact that I'm not going to bring religion into it, but if there's a problem, there's a solution. We don't just have identified all the solutions yet. And a lady got angry with me once when we gave her a diagnosis, and when she asked if it could be treated, we said no. She was like, if you diagnose it, then you must treat it. No, we are equally humans.
Was it beyond treatment?
Yes, it was already late. Now, not everything that is being diagnosed can be treated at the moment. I say at the moment because science is evolving, and every day we are looking better ways in which we can help
improve
the people, help the community, help our brothers and sisters so that they can live their maximum life. And because of that, we still keep hopes that with the small or with the knowledge that the technology that is already available, some can be treated if detected early enough, because some will be detected in this space where it's just a lump. Now the lump will be removed and case closed. It's solved, it's treated, right?
Like some kind of operation, you mean surgery?
Yes, surgery. So if it is detected early enough, they can conduct a surgery and the lump remove. The patient goes home happy. If it is detected late, even when the lump is removed or the breast is removed, there's already metastasis in the other breast. When you remove, there's already metastasis in the lymph nodes, and there is nothing we can do. So it can be treated if detected early enough for medical intervention. However, if it is late, we can only help that the person, we can manage the pain, we can manage the signs and symptoms, prolonging the patient's life to at least a considerable amount. If it is already too late, when the patient is already in severe and critical conditions, we can only take care of this patient, reduce their pain, and make sure that they live a peaceful last minutes of their life.
Okay, that's right. If you were to meet a cancer patient today, what advice would you, someone that has been diagnosed recently of cancer, what advice would you give to them?
Now, cancer is a big thing. It's a big news to bring to a patient. And everything around that news from that moment needs patience, needs empathy, needs considerations, needs love to attain. So if I were to meet a cancer patient now, I would tell the person to keep their heads high up, to remove the thoughts in their head that probably they are dying tomorrow, or they are dying today, or they are given a time limit. I, for one, as a healthcare personnel, have worked in situations where I've been exposed to talk to cancer patient. I will always tell you that the diagnosis given by the doctor is what the machines have set. And there is one thing that can beat machines. One is your head. And two is God.
So these are the two things you are going to tell them?
I am going to tell them to keep focus. This is where I'm bringing up. I'm going to tell them to not give up on themselves, because some patients give up on themselves the very minute you tell them they are cancer positive for a particular type of cancer. They know they are dying and there is nothing else you're going to tell them. Is as long as you have a positive mindset within yourself and making sure that you take your medication and take every procedure, do the screening and make sure that everything comes together, live a healthy lifestyle from that time period, making sure that if you were smoking, you stopped, if you were drinking, you stopped, all these things coming together. If your lifestyle, you live a very toxic, sedative lifestyle, you try to change that and get yourself incorporated in healthy living, healthy dieting, live on much vegetables, fruits and all that, you are going to actively help us, help you progress your life at a maximum level in which you will want to live.
You have been exposed to cancer patients, you said. During your counseling sessions, have you had cases where they open up to you to tell them how their family members and friends treat them, with this stigma? And
yes.
How do you think that someone who is in this condition should be treated by family and friends?
The community has a whole lot of role to play. The family, the friends, the whole community has a whole lot of role to play when it comes to patients in a whole. It's not just about cancer. We could be talking here about HIV. We could be talking about hepatitis. We could be talking about diabetes, hypertension. Every environment or every patient needs a healthy environment. And that healthy environment will start with the immediate family members. First of all, getting themselves equally educated. I don't always educate just a patient. I educate the patient and their family, because it takes a community to build. If this individual has to be strong, you all need to have the same positive mindset as them. Because it's like going to the hospital, telling a patient you're having cancer, you counsel the patient goes home and tell the husband, I'm having cancer. The husband starts dying first before the patient. As long as you have it in your head, oh, my wife is going to die, my mother is going to die, and all this, it deteriorates yourself, it deteriorates the patient even more, and the patient knows there's no hope. But now if you bring this positive energy, making the family understand that even though this thing has been dictated, it is early enough, we can manage this is under control and all this, and they go home with that same positive energy, making them know which part they have to play. They have to play a part of this person is a drunkard, we need to remove this person from drinking. And if you are the active person that gives them that alcohol, you need to stop. If this person needs to stop smoking, then I, as a family, know that we need to encourage the individual. We cannot just cut them from smoking. How many sticks of cigarettes do you take per day? I said 5. All right. Now you are the husband, now you're the child. Let's make sure tomorrow he takes 4. And the day after tomorrow he takes 3. And the day after he takes 2. Until we get to 1, and when today we'll be like, okay, you know what? Let's just try to go through today. Active observation, activeness into that person's care. The wife who is cooking, or the child who is cooking for their mother, should be known, okay, I cannot give my mother a lot of sugar. Cancer cells live on sugar for their growth. They live on high calorie food for their growth. And I told the patient that your mother needs to take just vegetables, your mother needs to take sugar-free food. I, who is preparing, knows that that's the part I have to play. I have to give her food that is having no sugar or calories-free food. I have to give her low carbohydrates because it will still contain sugar. And all this just to make sure that if the cancer cells are starved, they will die a natural death. Okay? We need to love the individual. We need to identify that they are going through grief. And we join them to pull them out. We need to see signs and symptoms. We need to be observing so that they don't get into depression. These are certain things that as a family, we will come together to give our loved one a good time. Instead of making them feel like, okay, they're going to die today, they're going to die tomorrow. So what's it? Some families, we've seen cases where they can even help take your life for you, you know?
Yeah, with the way they treat you.
With the way they treat you, yeah. So it is necessary that the family comes together and make sure that they actively love and show empathy and show concern and show a sense of support for the individual that is suffering of cancer.
Aisha, thank you so much for talking to us on the program. We are expecting you again some other time. Until then, bye.
Thank you.
Ladies and gentlemen, you heard from Aisha then. The prevention of cancer remains a corporate responsibility. You and I have a role to play. That was it for the program. See you again in another edition. Bye.